The direct anterior approach, which is a technique I prefer to use for the vast majority of my patients, takes place through the front of your hip joint. The size of the incision depends a little bit on the size of a patient, but in general it's quite small, about 6 to 10 centimetres in length. Rather than splitting muscles or cutting through tendons, we move in between the muscles on the front of the hip to gain access and replace the joint. At the end of the procedure, no muscles or tendons require repairing with suture because they have not been cut during the operation. The principle of the anterior approach is to allow patients to mobilise more quickly with less pain and weakness early after the operation. Temporary weakness is created when a muscle or tendon is cut until they heal and recover. It's for these reasons that I'm so passionate about the anterior approach for my patients, because it avoids cutting muscles and tendons. But again, I would stress that all hip replacement approaches give excellent results in the longer term. The most important thing isn't what approach your surgeon uses, it's their skill and experience with whatever technique they are comfortable with. So you need to make a choice about what is best for you and your hip. If you would like to talk to me about your hip, then please ring my rooms at any time to make an appointment. If you haven't already had appropriate scans, I can arrange for these to occur before I see you.